I'm just going to get it pulled up on the computer really fast. Good afternoon, Hardin County. We are with Donnie Gill. He's the Public Information Officer with the Lincoln Trail District Health Department. Donnie's here to chat with us today about the Hepatitis A outbreak. The Health Department is offering vaccines if you are uninsured, but we'll get into that information here in just a minute. But wanted to let everybody know that since we're live streaming, if you have any questions for Donnie about the shot and really about anything else with the health department, I'm going to pull up the comments here on my computer so I can follow along if you do have any questions. So Donnie, get right into it. Let everybody know about who's being affected right now, who's with the hepatitis A, and what the public needs to do and know.
Okay. Now, how this all started, at least here locally, we had Jefferson County residents in our jail and in some of our treatment facilities, and they had tested positive for hepatitis A. So how this goes for the health department, everybody that those first few people came in contact with, we have to do an investigation to make sure that they're not hepatitis A positive at this point. So that was the initial wave of it, and that kind of started late December, early January. Then, at this point, we have some local cases, so actual Hardin County residents that have tested positive. So that's why we are pushing out the free vaccinations. These vaccinations are grant funded, so they're limited in supply, and it's kind of first come, first served.
Okay.
And that's why we're specifically targeting the uninsured, the underinsured, people who have had a past history of drug use and or homelessness.
Okay.
Because those are the prime risk groups right there.
Gotcha. So let's touch on underinsured, because I know some of the questions that we had were, you know, some people do have insurance, but their insurance won't cover the vaccine. But can they come to you and get the vaccine, or is that still case by case?
Kind of case by case. I would suggest calling first if you're underinsured and have questions about that. If you have no insurance, absolutely just show up on Thursday, May the 3rd, and we'll get you vaccinated. But yeah, if you're questioning, you know, I don't personally know all the ins and outs of how insurance and all that stuff gets kind of complicated.
Mm-hmm. But there's someone in your office that does.
Absolutely,
I'm sure.
absolutely.
Gotcha.
So just give us a call.
Okay. So let's see. We did have another question. How important do you think it is for people to get this shot? Because I know you said some of the cases that have been reported have been people who are incarcerated or are drug users. But let's talk about the general public.
If you look at the whole number of, let's say, Hep A cases, 30% of those cases happen to people who are not homeless and have insurance and don't use drugs. So it can affect anybody. The population, you know, that we're looking at, a lot of times they're working in jobs that are maybe in the fast food industry, maybe at a grocery store. So they're coming in contact with lots of people.
Mm-hmm.
So we want to, you know, again, emphasize we want our fast food workers to get vaccinated, you know, for that reason, just the amount of contact.
Gotcha. Okay. So what can you tell me about hepatitis A in general? What happens? What are some of the, you know, first symptoms? What does it do to a body?
Okay. Hepatitis A is caused by the hepatitis A virus, and that's a virus that affects your liver and liver function. Some of the initial symptoms, the dead giveaways, one is your urine will turn the color of soda, like soda be like the color of a Pepsi.
Oh.
Which would be pretty startling, you know, you wake up in the morning and you go to the bathroom. And then also their stool will become kind of a clay color. So those are two big indicators. Sometimes yellowing of the skin or jaundice. And then other than that, kind of general body symptoms, aches and pains at the joints, nausea. A lot of times we call those flu-like symptoms, and that's covers a lot of different illnesses. But the big ones are the colored urine and the clay-colored stool.
Okay. So you do have a clinic coming up
Yes.
this Thursday, May the 3rd at the health department. So that's running from 9 to 11 a.m. and 4 to 6.
Yes, and
Do you recommend people calling and making appointments in between those times?
it's just going to be a walk-in clinic.
Okay.
So again, kind of first come, first serve. But if you have questions about whether your insurance covers it or almost covers it, go ahead and call us at 270-769-1601.
Okay.
And this will be at our district office location on 108 New Glendale Road. I don't want a bunch of people rushing the health center on Westport. So,
Right.
So make sure you come to the New Glendale Road location.
Okay. All right. Again, so that's May 3rd from 9 to 11 and 4 to 6. You have anything else that you wanted to talk about?
Yeah, we kind of want to toot our own horn a little bit here. This is classified as an outbreak, and if public health wasn't funded and working the way it should, this outbreak would be a lot worse.
Mm-hmm.
But because, this is one of our core functions, disease prevention and communicable disease prevention, we're excellent at this. And this is how we affect everybody's lives. People out there, I don't ever go to the health department for anything. Well, we inspect your restaurants. We contain, hepatitis A as a prime example, but like E. coli, we do a lot as far as containing those kind of outbreaks. Pertussis or whooping cough, TB still pops up every once in a while.
Really?
And if you didn't have a strong public health system, those outbreaks could be a lot worse and spread a lot more widely.
Right. Well,
So,
thank you guys for what you do.
You're welcome. It's our pleasure.
Yeah.
We protect all of us.
Okay. Well, Donnie, we invite you to come back. We want to keep the Hardin local audience, all of our followers involved and informed with what's going on with public safety. So,
Be more than happy to.
Yeah, come back and chat with us again. But if you do have any questions, just comment on the live stream, and Donnie will be sure to follow the feed. But thanks again for stopping by.
You're welcome. Thanks for having me.